Okay, morning guys. Bit of a cold one this morning. So, just going to jump back on here. I'm going to follow on from my last video on MRIs. The last video was talking about the pitfalls of MRIs, which probably if you want to check that out, check out it on the YouTube channel. Today, I want to talk about what actually MRIs tell us. Okay, so basically, you know, a good MRI should give you a good synopsis of an area that's been scanned. Like, see, for example, the lumbar spine. It's probably the most scanned area because people get the most discomfort with back problems. So the lumbar spine is made up into 5 vertebrae, yeah? L1, L2, L3, L4, L5, and then the sacrum bone, S1. So a good report, we'll talk about the individual segments. So there's a disc in between each one. So when they report, it's going to be reported on L12, so a disc in between, L23, L34, L45, and L5S1. So they obviously normally start at the top and talk about top segments. The bottom ones, so basically L45 and L5S1, are the two most that go wrong. And that's because of the transition of forces, if you like, because we're going from a sort of, it's quite a mobile area, so it comes under a lot of forces and strains. Anyway, so you'll get a report and there'll be a lot of jargon on there, and you'll read it and you'll go, what the you know, and they'll talk about degeneration this and osteophyte this and, you know, compression this, and the GP will go, oh, you just got degeneration, live with it. No. Big no. As the old expression goes, you got to take the wheat from the chaff. You got to look at this MRI and cut through the bull. Okay? Now, anyone over the age of 25 starts to get degenerative changes. It's fact. We're born to die. And also some are worse than others depending on the careers that they've done, the sport that they've done and everything else. But everybody can be helped. Probably 95% of the people I see with back and neck issues, we can help, yeah? 5% that we don't, we'll talk about after. So, you get this report, and it talks about, you know, narrowing of the foramina, which basically a foramina is a hole where the nerve runs through. We talk about osteophytes, which are extra bony growth. We talk about disc dehydration, which means the disc is shrunk down. All these are sort of degenerative changes known as spondylosis. I look at these things and go, fair enough, okay, so what? I know that if I can get somebody mobilising, is again, like the last MRI on pitfalls of MRIs, I said that movement function cannot be seen on an MRI. So when I read a report that says they've got all these kind of things, I think, well, and I also assess the person, they're not moving very well. I know if I can get them moving better, all that pain will go away and all that stuff is irrelevant. The bit of the MRI I like to see, which concerns me more, is if they've got a disc that's worn down, if the nerve root, which is basically the little bit of the nerve which comes out the side, is being touched, well then that is causing sciatica. Now sciatica is a symptom, guys, it's not a diagnosis. So when the doctor says you've got sciatica, I go, so what? Did you ask him what's causing it? Because the worst cause is a disc pushing on the nerve. Even a restricted back that doesn't move properly can cause inflammation and cause the nerve to be irritated if there's degeneration. Because like an old worn car or an old worn washing machine, parts wear down and get closer and tighter together. This happens in our bodies. So, if you have sciatica and it's due to a disc, well, there could be the 5% that are difficult to treat. I'll come back to that. So yeah, so I see these MRIs and they've all got degeneration. We treat them 2 or 3 times, hey presto, pain goes away. The actual MRI doesn't change. They will still have the same sort of report, same kind of degenerative changes, but they're functioning, they're moving better, yeah? And that's what's key. This is what people don't realise, and unfortunately people miss this boat because, no disrespect, they go down straight to the NHS route, and the NHS route is you see your GP, he gives you pain medication. Your back will get better in 6 weeks. No, it doesn't. It's still stiff in the mornings, blah, blah, blah. They then send you NHS physio, which today, not to slag anybody off, but it beggars belief. They just don't get their hands dirty. It seems to be that they listen to you and give you a sheet of exercises to do, and that's it. So again, you can look up Dr. Google and find that yourself. Eventually, they send you for an MRI, and they come back with all these degenerative changes, and they say, oh well, you've got degenerative changes. Boom. They may send you to see a consultant. They may do spinal injections into the facet joints, which is when I actually treat somebody's back, the clicking noise you hear, which is actually, it's an air pocket. So every joint has a capsule, and inside the joint there's fluid called synovial fluid. So when you do a high velocity thrust, you're gapping the joint, you're not cracking a bone, and it's an air pocket, yeah? Well, those joints can be injected. The success rate of those injections are pretty poor. If you get 3 to 6 months relief, you'd be lucky. Now, if I can gap the joint and get it moving, pain goes away. So that's that basically. Trying to sort of, in a nutshell, tell you that MRIs show a magnitude of sins. So you need to see somebody who can actually cut through the bull of it and tell you exactly what is wrong, and not you get concerned about the whole list that's on the scan. Now finally, go back to the 5% of people that unfortunately need further investigation. I had a gentleman in yesterday for his 3rd session. I saw him 2 weeks ago. Basically, he's had a back problem for 8 months. He's had a scan recently. He's got a disc bulge at L5, touching the S1 nerve root. So he's got pain down his leg, can't bend forward, pain tracks in the leg when he bends forward. He's got pain around his outside of his foot, which is the S1 skin. It's called a dermatome where the pain runs. We've treated him 3 times. It's not improving. I didn't think it would from the first one, because normal people who have disc problems, if they're going to resolve, even on their own, you would hope to get some relief within 3 and 6 months. If they're not improving over 8 months, the chances are they're not going to. Yeah. So he will have to see a consultant. He's got private health. They will probably use a steroid injection first. But personally, I think in this particular instance, he's probably going to need surgery to shave off the bulging disc to stop touching the nerve. And when that bulging disc is shaved off, the nerve stops being touched and the pain on the leg will go away. Yeah. Now again, further MRIs down the line, you will still see that grumbly little disc that's been shaved off, because you'll see the disc will be narrowed down and everything else. Because discs do not go back into place. Once they bulge out like a tube of toothpaste, that's it. Now they can shrink back and stop touching the nerve, and that's what happens with people when we treat them and we get them moving again. The disc can actually shrink back a bit, which will stop the inflammatory process, which will stop the swelling, which means the nerve will stop being irritated, which means the pain will stop going down the leg. Yeah. I hope I'm not ranting on too much, guys. I'm just trying to sort of explain it in sort of layman's simple terms, because obviously a lot of people, what I found recently is, and that's why I'm doing these videos, is a lot of people go to people and they're not actually explained very well of what is wrong with them and what can be done. Okay guys, I hope this has been sort of, I can't even speak now. I hope this has been sort of useful, and I'll try and do some more of these videos in the future. Thanks now, bye.